Hi, I'm Dominic from Shift.ms. It's Wednesday, the 11th of March, and we are very grateful to have Professor Gavin Giovannoni from Barts in London join us to talk about something that's concerning everybody, and that is, what impact does coronavirus have on MS and vice versa? I'll turn over to Gavin to allow him to introduce himself.
Hi, I'm Gavin Giovannoni. I'm the Professor of Neurology at Barts and the London School of Medicine and Dentistry, and I specialise in MS, both research-wise and clinically, and I suppose I do most of my time now is dedicated to multiple sclerosis.
Does having MS make me more likely to catch coronavirus?
No, I don't think so. Coronavirus is a small virus that's enveloped in a cell membrane, to be honest with you, and it's spread by mainly droplets. It's not aerosolized like flu virus, for example. You don't catch it in the air. It's picked up from surfaces when people cough, and secretions get put onto like desktops, the door handles, etc. And so, if people with multiple sclerosis obey the common sense hygiene rules about washing hands, not putting their fingers in their hands in their mouth, their risk should be as low as anybody else in the community. And it's also avoiding high risk travel, high risk areas. If we can define the high-risk areas. And I think we'd be sensible about it. People with multiple sclerosis should be at no higher risk of getting the infection as people in the general population.
That's relieving to know. If I am unlucky enough to get coronavirus, regardless of all those things, how is it like? Is it going to affect me differently with MS? Are there any other factors like the drugs that I'm on, for example, that might affect it?
Well, there are two things. As you're probably aware, anybody who has multiple sclerosis and gets a viral infection feel pretty awful, particularly if they've got disability. They get a temperature and they get a fever associated with this, and it causes temperature-related conduction block. So existing symptoms can get worse. They can get fatigue and all that. I mean, that's what I would call the MS responding to an infection and the fever. So that's probably no different to getting a severe flu infection, for example. Now, the question everybody's asking, if I'm on a disease-modifying treatment and I get coronavirus, will I get worse coronavirus? And I suspect we have to say yes for people that are on immunosuppressive treatments, but not all immunosuppressive treatments are made equal. So we know that most of the immune response to viruses is by a particular set of cells called T cells. And not all immunosuppressive therapies that we use in multiple sclerosis affect T cells. So I think there's a hierarchy in terms of risk associated with these things, but we don't know. Just to say to you that the Chinese have put forward this hypothesis that what causes the damage in the lungs of people infected with coronavirus is actually the immune response against the virus, not necessarily the virus itself. And they're actually testing a whole lot of strategies to try and dampen down the immune response to lessen the damage in the lungs. So, there is this possibility that if people are on some mild immunosuppressive therapies, they may come out of this better than people who have very exuberant immune response to the virus. So at the moment we don't know, but I think we have to apply the principle that if you are on a chronic long-term immunosuppressive therapy and you do get the virus, it's likely to be potentially more severe.
One more question for you before there's a couple from our community, but another sort of standard question, I suppose, is a lot of us don't look ill, even to medical professionals. And if the worst case happens and I need to go to the hospital, how do I convince somebody, should we say, that I am possibly at greater risk and it may possibly need to be treated slightly differently than Joe average?
Well, I think what's making people go to the hospital is if they acquire complications, and it's probably the main complication that's driving people to hospital is respiratory problems, developing breathing problems, difficulty with breathing, shortness of breath. And the decision will be made. They've got a triage line, and you phone the triage line, and they will assess whether or not you're in a state that needs to be assessed by a clinician and potentially admitted to hospital or an intensive care environment. If you're not in that position and you've just got a bad viral infection, they want you to stay at home and self-isolate because you are a source of virus and you potentially would spread the virus into the general community. So the reason why they're saying to people who have symptoms, flu-like symptoms or symptoms suggestive of the coronavirus is self-isolate, keep yourself at home. The majority, I'm talking about the vast majority, we're talking about 85 to 90% of people will have a flu-like illness and overcome the infection and get better spontaneously at home. And I suspect the same thing will happen to the majority of people with multiple sclerosis.
And one thing that came up 3 or 4 times just today was people unsure that they feel they know more than their hospital does sometimes, because they're taking things like your articles, the published advice from the MS Society, the MS Trust, and they are armed with this information, and they call up their hospital and say, what does this mean for me? And several people have been met with the, I don't know, sort of response. So that concerns them.
Yeah, I mean, one of the problems I've highlighted before we went on to this interview is that we are really in an evidence-free zone. This is a brand new novel infection. I suppose people are worried because they're on immunosuppressive therapies and they're worried that they're not going to have the ability to fight the infection. I mean, just to go through, just to give the people MS, if you're on interferons, which glatiramer acetate, teriflunomide, and dimethyl fumarate, these are what we call the platform therapies. They really aren't immunosuppressive. They, broadly speaking, immunomodulatory. And so we don't think they're going to affect your ability to fight this infection in any way. As soon as we go up to the other drugs that do affect immune responses, they again are just mildly immunosuppressive. And we know from the phase 3 trials, open label extension studies, that you may have a slightly higher risk of getting viral infections, but they tend to be mild and severe. So you're more susceptible possibly to getting symptomatic infection. But the vast majority of infections are dealt with.
Another question from the community, and I guess it seems logical to wear a mask. However, there is now conflicting information. In the UK, there's advice against the masks not being particularly effective. People like Aaron Boster, the doctor who makes videos in the States, has said this. Yet the Italians seem to be recommending it. And it's the do I, don't I get a mask, and what kind of mask do I get?
Yeah, so this is actually where the advice is very conflicting. So you probably don't need the mask to protect yourself from being infected, because infections normally come from your hands and from surfaces. And so the mask may actually make you think about things more. It may make you more aware. But again, there have been videos of people with these masks showing you it actually does the opposite. It gives you a false sense of security. The masks really, if you've got the infection and you're coughing, it protects people from getting the infection from you because it traps the droplets inside the mask. Yeah, so the masks are probably not effective. And if you are going to use masks, you have to use good quality ones, one with respirators in, because they've got a certain filtering capacity. And so those need to be bought usually from specialist healthcare professional or suppliers. They're quite expensive, and there's a category of safety associated with these masks. So yes, the general advice in the UK is masks probably make no difference. If anything, they may counteract common sense.
So, Gavin, given that this is Wednesday, the 11th of March, and things seem to be changing so fast, is there anything you'd like to add about the way advice and the speed of the developments?
Yes, so I think as this epidemic evolves, things are changing very rapidly, both at a public health level, in other words, what the government's talking about at a public health level, but also the evidence emerges very rapidly. In the last 2 weeks, we've had several publications, several guidelines coming out. So what I say today may be very different to what I would say in a week's time. And actually, my personal opinion has changed a little bit over the last 2 weeks. And I'm almost certain the evidence base will change over time and the advice will get much better with time.
And we're doing our best on Shift.ms to keep everybody updated with things like the articles that you write. They're really appreciated. So thanks very much again.
Pleasure.
All right. Bye-bye.
Bye-bye.
Okay, everyone, we've heard from one of the leading experts in the UK there. It was a fascinating video. I, for one, am feeling a great deal less concerned than I was regarding my ocrelizumab. It doesn't mean I'm not concerned. It just means that it's all the 20-second stuff for the hands. Anyhow, if you like this video, please comment on it. You've heard this all before. Please like it. Please share it. Please subscribe to it. Tell people. We will be doing more videos along the lines of this. So just stay tuned and be safe. Wash your hands. Take care.